You'll get an audio indicator letting you know. Sometimes it makes you jump. And we'll go from there. Sorry, my computer is having some issues. So before we get into our presentations, I'd like to provide a bit of background on Age Friendly and our Alberta community practice. So Age Friendly is a global movement spearheaded by the World Health Organization. It's a model to enable active, healthy aging by focusing on 8 domains of community living, as you can see in the diagram. Age Friendly communities help seniors remain engaged in their communities through the development of supportive, built and social environments that facilitate exercise, social connection and respect for seniors. The journey to becoming age friendly employs a bottom-up participatory approach that involves the active participation of citizens of varying ages and abilities in all aspects of planning. The cornerstone of the age-friendly model is the development of a community plan that brings together traditional and non-traditional partners to identify community assets and strengths that facilitate social inclusion of seniors and factors that hinder it. Each age-friendly plan is unique as it addresses the community's specific needs. And implementation can be achieved through small steps initiated by local community members, through more major initiatives that require greater resources and contributions from a broad group of people, or the collaborative efforts of a range of groups. The Alberta Age-Friendly Community Practice is designed to help communities that are considering or in the process of developing an age-friendly plan. In this closed group, members meet regularly and offer support to each other in a mentoring capacity. But there's also a discussion group that's open to anyone interested in the age-friendly concept or its 8 domains. The focus of this group is more on disseminating information and providing opportunities to ask questions and share information. Members may or may not be involved in an age-friendly initiative. If you're interested in learning more about Age Friendly in these 2 groups, I would encourage you to visit the corealberta.ca website. Okay, so just setting the stage. So the seniors population is multifaceted with diverse living arrangements and housing needs. As individuals age, their needs and capabilities can change, and they may experience challenges in finding housing to accommodate their evolving needs and service requirements. That's one of the main reasons why the Alberta Age-Friendly Community Practice is exploring this topic and sharing information to support the housing needs of older Albertans. The population aged 65 years and older is expected to increase both in number and proportion of the population. Most seniors want to remain in their own homes for as long as possible. So according to the 2016 federal census, the majority of Alberta seniors, so it's approximately 90%, live in private dwellings. And those private dwellings include movable dwellings, that's around 3%, apartment buildings, 15%, and houses, which is 72%. The approximately 86% of seniors in Alberta in private dwellings are homeowners, while about 1 out of every 7 Alberta seniors is in a private dwelling as a renter. And close to 24% of Alberta seniors in private dwellings live alone. Seniors are less likely to move than the general population, and housing moves by seniors can be characterised as either lifestyle, planned or crisis, each of which is typically underpinned by a number of push, so for example, the death of a spouse, or pull factors, which might be a desire to be closer to children or grandchildren. And according to the 2021 Alberta Seniors and Housing Annual Report, the Alberta Seniors Benefit has provided to more than 170,000 seniors with low income to better meet their basic needs and assist with monthly living costs. And so why is the Alberta Age-Friendly Community Practice hosting a series? Well, according to the World Health Organization, the housing conditions of older people are often linked to their quality of life and whether they're able to age independently and actively in their community. Appropriate housing design and its proximity to community and social services allow older residents to live comfortably and safely, while housing and affordability gives them peace of mind. On this slide, you can see a few of the location design and affordability factors that the WHO considers important when looking at how age-friendly a community is. When considering affordability specifically, the CMHC's threshold for all Canadians is housing that costs no more than 30% of gross household income to ensure resources remain available for food, transportation, other basic needs, and other factors that contribute to quality of life. So through this 5-part series, the Alberta Age-Friendly Community Practice has been exploring the range of seniors housing from homelessness to continuing care. And the goals of our series have been to help foster a shared understanding of the housing needs of seniors, identify enablers to support seniors to live independently, encourage and facilitate a variety of age-friendly housing options for seniors. So in the first session, which was held on February 23rd, we set the stage by looking at why this topic is important, where Alberta seniors live and their housing preferences. Participants also heard how the Alberta Affordable Housing Strategy supports housing for low-income seniors. In the second session on March 23rd, it provided participants with a picture of what homelessness for seniors looks like, how their experience is different from younger populations, and information on how work being done to address homelessness is being achieved among seniors. And participants also learned what living well in community means from a housing perspective, some of the challenges and opportunities, and what role community partners can play in supporting affordable housing for seniors. Session 3 focused on characteristics of age-friendly housing for seniors. Participants learned how the spaces people live in impact their independence, how accessible architecture can support aging in place, and trade-offs that older adults face when they want to renovate their homes to make them more accessible. They also heard about work happening in the United States to support communities in diversifying their housing stock and encouraging more accessible market housing. The fourth session, held on March 18th, showcased innovative housing models for seniors. Sorry, that was May 18th. Participants heard what makes the programs innovative, what need the program aims to address, and the challenges and successes experienced in developing each of the models. Participants also heard how these models aim to provide alternatives in seniors housing by offering opportunities for intergenerational connections for Indigenous seniors, and a focus on facilitating community, companionship, and supplementing income. Okay, so I think we can get into our agenda now. In this final session for the series, participants about what older adults should consider when thinking about advanced planning and making housing transitions from a legal perspective. Information will also be shared about the role of continuing care, including home care, in supporting aging in community. Participants will also learn about Alberta's plan for transforming continuing care. So we are fortunate enough to have with us today Carolyn Teller, who is a lawyer in estate planning. Cindy, has she been able to connect?
I see her device and she's here. Can you check your mic, Carolyn? Awesome.
Yep. Perfect.
Perfect.
Okay, I will continue my introduction then. Welcome, Carolyn.
Thank you.
So Carolyn was born and raised in the smaller than small hamlet of Duma or Dummer, I'm not sure, Saskatchewan. Her parents' goal for all 6 children was a university education, a big feat on a farm income. She graduated from the University of Regina with a BA and went on to Saskatoon to graduate with a law degree. After graduation, she moved to Alberta, where she found articles in Red Deer, an opportunity presented in Innisfail to practice with a sole practitioner in his 60s, and she made Innisfail her home and has been practicing there for 42 years. Excuse me, still loving her job, and it appears the law practice will continue as she now works side by side with the youngest of her 3 sons. Then we have Sophie Perja. Sophie is the Director of Supporting Housing and Residential Living with Alberta Health Services Provincial Seniors Health and Continuing Care Team. And she's joined by Michelle Taylor and Latifa Adoye, who are both leads with the team. So, and then we have Kirsten Kashuba, Kirsten is currently a Director of Strategic Policy and Planning for Continuing Care in Alberta Health, originally hailing from Drumheller, Alberta. Kirsten found her way to Edmonton, where she completed her education at the University of Alberta. Kirsten's career with the Government of Alberta has now spanned 14 years and has focused on serving seniors and persons with developmental disabilities in the Ministries of Health and Seniors. She's proudly serving on the board for the Edmonton chapter of the Alberta Association of Gerontology and is happy to be here today to connect the community-based senior serving sector. Okay, and I will pass it over to Carolyn. Thank you very much.
Thank you. It sounds to me like I should have attended all of the initial sessions. They sounded very, very interesting. And I hope that what I'm about to say today isn't repetitious. Anyway, onward and upward. I'm particularly interested in this particular seminar because I too am a senior, and I've actually watched my parents age and go through with them their struggles to remain fiercely independent. My mother passed away from dementia, basically, after living for 5 years in a nursing home. My parents moved from the family home from Dummer, Saskatchewan, was precipitated because my father could no longer manage my mother's care. After my mother passed away, my father had established a residence and he managed okay until he turned 90. And then I would say the last 2 years of his life were very, very difficult because he was forced into assisted care and then to a greater level of assisted care. So I find these seminars very interesting, but sometimes very difficult remembering what I saw them go through. So before I get started, I always like to say that the information I'm about to give you is very general. Other advice might be given by lawyers based on your own fact situation. So don't take everything that I say as gospel. So in the program today, I wanted to talk about several areas, starting with aging and decision-making, housing, the sale of your current residence, whether it's private or through a realtor, maybe the purchase of another residence, estate planning with downsizing, and then depending on time, we might get into a little bit of vulnerabilities and scams. So with regard to the aging and decision-making, there comes a point when seniors begin to think about what they might need to do. These thoughts are quite often driven by feelings of perhaps insecurity. People don't really feel they're now able to look after their own properties, either through infirmity or inability. Sometimes people just want change for the sake of change. I'm not sure what you have experienced, but I find that women seem more willing to make change than men will make change. So women seem to be advanced planners in this area. So if in fact you're going to consider change, then I guess the two things that I feel are uppermost in your mind is whether or not you need care and what kind of housing, what kind of house are you going to be moving in, or what will be your housing look like? We go to the next slide. As far as housing, I'm a great advocate of stay where you are. When I went to visit my father in his assisted care facility, he took me into his bathroom and he said, "Now, Carolyn, this is my brush and this is where it is. This is my comb, this is where it is. This is my toothbrush, this is where it sits. Now don't move those items because I know where they are." It dawned on me that because my father moved out of his own home, he now had to remember where everything absolutely was. Had he been left in his own home, if he could have stayed there, he wouldn't have had to take me into the bathroom and shown me where everything was. So I realized how difficult it was and how taxing it is on one's mind. Now, there's lots of times where you can bring care into your own home. If you think that that will solve your problem, that would be fantastic. I've had people that I know that have moved into care facilities and actually moved back into their own home just because it turned out it really wasn't what they thought it was going to be. That's why I say if you want to leave the back door open, you could always come back. Now, assuming that you really must move, what do you need to think about in the downsizing process? Most people want to reduce the amount of space they have. Some people say, oh, my home is just too big, I can't look after it anymore. Well, if that's truly your only problem, then do you just downsize to a smaller home? But if you're saying more than that, then you have to start to consider other options. So I think what you have to do is decide what is important to you. And most people take into account what is important to your children as well, or other close acquaintances. If you move to a facility, will you be able to do the things that you want to do? So if you've made the decision that you can no longer remain living in your current home, then you have some options available. Should you move into a smaller house? Does this really address your concern, or does this just prolong the inevitable? The second option might be a condo. People like that idea. They say, well, I'm safe and sound in my condo. I have lots of security here. If I want to go somewhere, if I want to go visit my children, I want to go on a trip, I can just lock my door and I can leave. Now, people also complain about condo life. They're not used to living by somebody else's rules. They like to live by their own rules because most people have become very independent by this stage in their lives. Remember, if you live in a condo, there are people that are in charge of the condo. There's common areas that all of the people can use. Remember, you still have to pay your taxes. You probably have to pay your telephone and your internet. And you'd have to think about, well, what do I need in a condo? Do I want underground parking? Do I need extra parking? What are the amenities in my condo? Are there restrictions on the people that can actually occupy your condo? Are you going into one that is age restricted so that you're aware that everybody there is at least over the age of 45 or 50 or something of that nature? Now, if that life doesn't suit you, people have come to me and say, I just want to rent. I don't want to be responsible for the house anymore. I don't want to have to look after anything. So I'll just rent. The problem with renting is that you're at the mercy of your landlord if, in fact, they decide to sell the property or they want a family member to move in. So is rental really stress-free? If you're moving because you want stress-free living, really check that option out. Of course, the next one is a care facility. Now, that doesn't have to be so negative because there are care facilities that provide just the right amount of assisted care. So you have to think about what care you actually need and whether the care facility can provide care. I always say to people, remember, if you're going in there because you want somebody to get you up in the morning, you want somebody to help you get to bed at night, you want to do all those things, remember in that facility, everybody wants to get up at the same time and everybody wants to go to bed at the same time. So you're not necessarily going to get the one-on-one care when you want it, basically. So you are faced with a number of rules. If you're considering a care facility, I think one of the things that you really should do is talk to someone who's in that care facility or talk to a family member that actually has a care facility, that actually has somebody in that facility. Are meals important to you? Find out about the food. My father-in-law stayed at Paragon, I always call it Pentagon, Paragon Place in Stettler. The staff were absolutely fantastic. And above all, the food was fantastic. I talked to a good friend of mine that moved into a facility, and the food was terrible. And that happened to be one of the highlights of her day were meals. So you really need, I know it sounds trivial, but it isn't. Meals are very important. Entertainment. Is entertainment important to you? I'm not sure how much participation there is in entertainment. So I think you need to check that out. Also, social interaction. Are the people, if social interaction is important to you, because people do move into care facilities so they can be socially active. If people in this facility are basically coming out for meals and then going right back into their rooms, really there isn't the social interaction that you think there might be. Now, if in fact you've decided to move and you've already decided on your next residence, then I guess I wanted to talk to you about how would you sell your property. I had a woman in her 90s in Innisfail who wanted to sell her home. And she posted on her lawn a for sale sign, and it was sold by the next day because someone drove by and said, I always wanted to buy that home. So selling your own home doesn't have to be complicated. The advantages to selling it on your own, first of all, is cost. You don't have to pay a realtor's commission. You can take your time selling it. You have a lot of decisions, though, you have to make. You have to decide on sale price. You have to decide on a sale price. You could look at what's sold around you and find out what, in fact, properties have sold for. You could ask opinions from others who might be in the know. You could obtain an appraisal. Quite often, a realtor will do an appraisal. They won't charge for it. Ultimately, you might end up even using that realtor to sell your home if you don't find a buyer. So in order to find a buyer, once you've made a decision over sale price, you could look at your neighbors. Is there anybody in your neighborhood that knows somebody that wants to live in your neighborhood? You could ask your friends. You could put an ad in the paper. You could go online if in fact you're tech savvy. Or last but not least, you could put up a sign. That might even work. The problem with selling on your own is you have to be comfortable showing your own home, and you have to be able to weed out the lookers from the people who are going to actually get serious. If you're going to have people come into your home, you have to make sure that you protect yourself. You have to make sure that you have somebody there with you. Remember that talk is cheap. Don't be hasty. You don't need to say what you're selling for. You can ask people to make you an offer. Remember, until they've made an offer in writing, you really have nothing at all. Be aware of what I call the low ball offer. Let's say, for example, your house was worth $250 and someone comes in with an offer of $200. They're not actually looking for you to seriously consider their offer. They're actually just looking for your bottom line. I wouldn't even give them the courtesy of a response. They're not going to find out that information from you by giving you a lowball offer. You can just tell those people, when you make me a reasonable offer, we can start to negotiate. What happens when you find the buyer? Should you draw up your own offer to purchase? My advice to you is absolutely not. You're going to have a lawyer represent you on your sale, regardless of whether you're going through a realtor or whether you're selling privately. Go to the lawyer. It takes me probably less than 10 minutes to draw up an offer to purchase. I never charge for drawing up the offer to purchase. I want to solve the problems before they start. If you do your own offer to purchase, quite often you'll make a mistake. You'll make a promise you can't keep, and you'll end up spending money to complete the sale that you didn't anticipate. So as I say, contact your lawyer. They'll be happy to draw you up an offer to purchase. Generally, drawing up an offer to purchase is supposed to be the buyer's job, but I'm of the opinion that if you've got a buyer out there and they don't want to go to a lawyer to have an offer to purchase drawn up, of course we're going to draw one up for you and you just present it to them. There's no point losing a sale because they can't draw up an offer to purchase. Now, if you've decided that selling your own home is just too much for you, of course you can use a realtor. There's many advantages to using a realtor, and in my program, I don't list all of those advantages, but I know that they would be more than happy to talk to you about it. I generally tell people the main purpose of a realtor is to find a buyer. If you've found your own buyer, you don't need a realtor. Now, if you were going to buy a home, let's just say your downsizing consisted of buying a home or buying a condo, for example, do you need a realtor to do that? Once again, if you found a place you like, you don't really need to go through a realtor. You can. In Alberta, of course, the purchaser doesn't pay for the realtor. The vendor pays for the realtor. So if you want a realtor assist you, that's very good. If you found a place you want to buy, we want to draw up the offer to purchase. Basically, if you're going through a realtor, the realtor will want to draw up the offer to purchase. Whether you're selling or buying, my recommendation to you is that let your lawyer review the offer to purchase. We're not there to cause trouble. We're there to prevent trouble. So it is a good idea to go and have your lawyer look at it. Generally, in 5 minutes, I can look at an offer to purchase and see whether or not there are pitfalls, and I can get them corrected right at the very beginning of the transaction. Good. Sometimes when people buy that next residence, they want to start to do a little bit of estate planning at that stage. I have lots of people say to me, well, should I put my son's name on the title? Should I put my daughter's name on? It is actually very good estate planning to put others' names on the title. These are people that you have to absolutely trust, because when you pass away, if it's a joint tenancy, they will become the sole owner. And unless you have an only child, you'll be counting on them to share that property with the others. But it does make good sense, and it doesn't cause you any tax problems at all. Once you put your child's name on your title, though, you have to remember that you might assume some of their problems. If in fact they had a debt problem that arose, you could end up with their debt being filed against your title. So it can happen in situations, but as I say, consider the person that you're putting on the title, and you're likely not going to put somebody on the title that has debt issues. When we do estate planning in this way, and we put the property in both names, we actually have the child sign an agreement to admit that they're basically holding the property in trust for their parent. And we actually make them sign a transfer giving the property back to their parent. So the parent can at any time put the property back into their own name. We've had to use that transfer back probably 3 or 4 times in the last couple of years. So it's often enough that it actually has worked for people when there has been a problem. If you're going to start doing estate planning, you might as well, if you're putting a house into joint names, you might as well look at other aspects. Look at your banking, look at your investments. Do you want to put those in joint names? Do you want to ensure that that property, the bank accounts pass to the next generation very easily? Make sure that if you have the ability to name a beneficiary on your investment, if you have a tax-free savings account, for example, you can name your children as the beneficiaries. That's an easy way to get the property out of your name when you pass away. This isn't a seminar to deal with wills, powers of attorney, and personal directives, but I'm sure you've all heard of these items. And those are a good idea too, because the power of attorney and the personal directive actually anticipate your own incapacity. And I always say to people, these are documents that I hope you waste your money doing. I hope they never come out of your back pocket. I hope the plan never has to be used. But if you don't have the plan, then you have a real problem. It's like buying fire insurance. We all insure our homes every year. We're not doing it because we want our house to burn down. We just want a plan. The same thing with the power of attorney and a personal directive. You're not doing it because you want to become incompetent. You just want a plan if in fact you do become incompetent. I think maybe because we started maybe a little bit late, I'll just wait for the moderator to say whether or not I would touch on vulnerabilities. I don't really need to. You'll get this information. And I think it's pretty straightforward because people are approached. In fact, I just got a phone call yesterday from CRA, supposedly. Of course, it wasn't from CRA at all. Anyway, what do you think?
Thanks, Carolyn. I think we're running a little short of time, but thank you very much for your presentation. And I think we're going to hand it over to Sophie for the next one. That was excellent.
Thank you.
Thank you so much, Sean. Good morning, everybody. My name is Sophie Perja. Really happy to be here along with my colleagues Latifa and Michelle this morning. To give you a quick snapshot overview of continuing care services and how to access them. I'm located in Mohkinstsis, Calgary, on Treaty 7 territory and Métis Nation of Alberta, region number 3. And my colleagues Latifa and Michelle are located up in the Edmonton area, in Treaty 6 territory and Métis Nation of Alberta, region number 4. So with that, I'd like to advance to the next slide, and I'm going to turn things over to Michelle to get us started.
Great, thank you, Sophie. So Alberta's continuing care system provides Albertans with the health, personal care, and accommodation services they need to support their independence and quality of life. And continuing care services includes assistance with dressing, eating, bathing, and meal preparation, respite care, wound care, medication administration, and various other healthcare and support services. And these services and supports may be provided in different settings, including the individual's home, community-based service locations, and residential care facilities. And there are 3 main streams of care within the continuing care system. There is home care, supportive living, also known as designated supportive living, and long-term care. Sorry, my mouse isn't cooperating. And there's also hospice and end-of-life care that can be offered in each of these 3 care streams. So next, we're going to have a closer look at each of these care streams. So home care provides various supports that helps people remain well, safe, and independent in their home or in a congregate living setting in the community for as long as possible. A congregate living setting means a place where several people live together, like a senior's lodge, where residents have their own rooms, but share meals in a dining room. And home care is a health and personal care service that supports Albertans of all ages to remain well and independent in their own homes for as long as possible. And it can be short-term or long-term and includes elements such as case management, professional care, personal care, home and community support services, and self-managed care. Sorry, my mouse isn't shifting over for me there. So let's just see if we can Sorry, I'm just going to take a second. I apologize. Okay, here we go. Goals of home care include support individuals to stay healthy and independent longer, support connections with community and social supports, reduce the need for emergency and acute care, allow for earlier discharge after acute care stay, delay the client's need for designated supportive living, long-term care or other higher levels of care, and respect an individual's choice to live in their own home, closer to family and friends. Okay, and we'll go to the next slide. Okay, so on the screen here, we have two elements that we're going to discuss, and that is supportive living, where you can contact the site directly. And then the second option is supportive living, or also known as designated supportive living, through Alberta Health Services. And I'm sorry, I don't know if my battery on my mouse or just not able to advance my slides. Latifa, are you able to present that slide for me? Or Sophie?
Why don't I go ahead?
I can present.
Oh, you go for it, Latifa.
And we just need to go back one slide. We just didn't cover the content on, yes, there we go. Thank you so much.
Go ahead, Latifa.
Okay, yes, I am working on that. Just give me a minute. I was using a smaller screen. Yeah, so I would do that now. Okay. Is it this one, Michelle?
On the supportive living, yes.
Okay, there you go. Can you see my screen?
No, they're presenting for us. I actually have the content now, so how about I'll carry on, and then I'll get you to catch up on the slide originally intended. Sorry for the confusion, folks. Supportive living are facilities where services such as meals and housekeeping are provided in order to support residents to live as independently as possible. And there are two ways of accessing supportive living, and they include accessing through the site directly and accessing through Alberta Health Services. So at the top of the screen, supportive living access through the site directly includes seniors lodges and private supportive living sites. The seniors lodges are funded by the government, while the private supportive living sites are not. And individuals have to pay from pocket to live in a private supportive living sites. Home care and on-site healthcare services may be provided at the seniors lodge or private supportive living sites, depending on the part of the province where they are located and the building operators. So for the bottom part of the screen, where supportive living is accessed through Alberta Health Services, is also referred to as a designated supportive living. And this is where residents who need a higher level of care, support, and monitoring reside. The supportive living beds are publicly funded, and there are different levels of care for residents who have different care needs in supportive living. So there is, we're featuring DSL 3, 4, and 4D. And so level 3 and 4 support residents who require assistance with personal and healthcare needs. And level 4D is where clients with dementia requiring a secure setting live. And healthcare aides are on site within all levels of supportive living. And regulated nursing staff are on site for supportive living levels 4 and 4D and provide visits and on-call service for level 3. Other healthcare professionals may visit to provide physiotherapy, occupational therapy, recreation therapy, dietary services, and much more. So next, my colleague Latifa will provide an overview of long-term care.
Thank you, Michelle. So Michelle, are you still able to present, or do you want Sophie to help out so I can do the demo in one of my slides?
I believe one of the administrators for the conference is presenting, so I'm not presenting. So
okay.
So I'm not sure we'll be able to offer that today.
Oh, okay, sounds good. All right. So hi, everyone. My name is Latifa. I'm just going to quickly show my face and then turn off my camera so that there will be a good quality of the presentation. So I am going to take you through the next slide, and we're going to start with long-term care. So we'd like everyone to know that the care provided in long-term care is specifically designed for individuals with complex and unpredictable medical needs, requiring 24 hours on-site nursing intervention. Care is provided 24/7 by a blend of healthcare staff, including healthcare aides and regulated nursing. Other healthcare professionals, including therapies and other healthcare professionals, they provide therapies and programs on site during work hours, and they usually require referral before seeing the residents. Recreation staff offer many enjoyable leisure activities to help promote residents' well-being and independence. And also, other direct and consultative healthcare services are also provided on site, including physician visit. So next, we're going to talk about hospice or end-of-life care. Okay, I'm just waiting for the slide. Yeah, thank you. Hospice or end-of-life care can be offered anywhere in the continuing care stream, including standalone hospice setting or acute care hospitals. The care provided in this setting incorporates patients and families' value, their preferences and goals of care, and it spans the disease process from early diagnosis to end of life, including bereavement. Hospice or end-of-life care utilizes an interdisciplinary approach to meet the individualized needs of the patients, their families, and/or the caregivers. It also addresses the physical, emotional, spiritual, practical, and social concerns for individuals at all ages and stages of life. As you can see, under the photo on the slide, there is a link to the Provincial Palliative End-of-Life Care website. Information about this website will be discussed more in details in the next slide. Next slide, please.
Latifa, I'm just going to interject for a second and ask, I think Carol is sharing the screen. And Carol, I'm just wondering if we could be able to present from our side. That's okay. It just shows on my end, tech support, Carol's screen is sharing. So
yes, no, I just wanted to, who wants to do it? I'll just make you a co-host and you should be able to, or what are you hoping to do?
Oh, we wanted to give a live demo of some of the screen, the web links on this screen. So,
or do you want me just to click on it?
Latifa, what's your preference at this intersection?
Honestly, Carol, I know you're going to do a fantastic job, but Michelle and I have run through this a lot of times, so I think it will be better if she presents her screen because she kind of knows the presentation as well.
Okay, I'm just trying.
Thank you.
So I've made you co-host there, Sophie, and now you're going to share your screen.
I was hoping to, yes.
Okay, go ahead, Sophie.
Oh, sorry, Carol, that's Michelle speaking.
So Michelle is going to be the one who's going to be sharing her screen?
Yeah, that's right.
Okay. All right, Michelle, go ahead. Thank you everyone for your patience. Our technology is not our friend today. So.
Okay, Latifa, carry on, please.
Okay, great. Thank you, Carol and Michelle. So on this slide, we're going to talk about how to access continuing care services. We want everyone to know that you can access continuing care services via the options shown on the screen. So first, we're going to talk about the continuing care access line. The continuing care access line is one of the major ways of accessing continuing care services. The line offers telephone information, screening, and referrals for individuals who require access to continuing care services, including home care, supportive living, palliative care, day program, and facility living program. Anyone in Alberta can access continuing care through the coordinated access line by dialing the number designated to each zone. We also like you to know that no physician referral is required. Anybody can call this line and get the help that they need. So for the purpose of this presentation, we're going to demo for Edmonton zone. And as you can see on the screen, Michelle is presenting the Edmonton zone website for their continuing care access line, which is located on the right-hand side. Also, we're going to show you the zone map. And the zone map just shows you where your area is located in Alberta, because the continuing care access line is based on zones, as you can see on the screen as well. We believe that this presentation will be shared with everyone. So in your leisure time, you can just go in and click on the zones and see where your area falls in. So next, we're going to talk about the dementia advice line. The dementia advice line responds to immediate needs of persons with dementia living in the community and their care partners who require health-related advice, education, information on continuing care resources, and also emotional support for the events that occur during the course of dementia. We want you to know that the line is free, confidential, and it operates 24/7. Anyone can access this service by dialing 811. Again, you can see Michelle is presenting the website on the screen. Next, we're going to talk about the continuing care website. And under the continuing care website, we will focus on the facility directory. The facility directory is embedded in the continuing care website, as you can see, and residents and their families can find continuing care sites of their choice using the continuing care facility directory, depending on the resident's access level of care. Meaning to say, there are two types of spaces. There are spaces that can be accessed through sites directly, which include senior lodges and private supportive living, as we mentioned earlier in the presentation, and spaces that can be accessed through AHS case manager, which includes designated supportive living and long-term care. It is important that you know the difference between these two spaces, because some sites may actually offer both spaces, and it's important for you to clarify exactly what you're looking for. So for the purpose of this presentation, we're just going to quickly demo how you can access a continuing care site, how you can search for it using the continuing care facility directory by the name search. So as you can see what Michelle have done, she clicked on the search button, and we're just going to use the first name that came out, which is the aged care. So as you can see on the page, you have all the information that you need, the contact information, the location, the services that they provided. And there's a section on the screen as well where you can see other additional charges that you need to pay in case you're going to live at the site. So next, we're going to talk about palliative end-of-life care website. This is a centralized access point where patients, families, and healthcare provider can find resources and learn more about palliative end-of-life care. Again, you can see that Michelle is presenting that on the screen. We apologize for the technical difficulties, and we hope that when you get this presentation, you take the time to click on the link and get familiarized with it and see how you can actually access continuing care services. So thank you, everyone. I'm going to hand it over to the next presenter now.
Thank you, Latifa, and Sophie and Michelle. And we're going to hand it over to Kirsten to do her presentation. Go away.
Great, and I'm hoping Carol can assist in putting the presentation back up and sharing the screen. Beautiful. All right. Well, good morning, everyone. Thanks for the opportunity to speak to you today. So today I'm here in Edmonton. It's a beautiful day, and we're sitting here in Treaty 6 territory in Métis Nation of Alberta Region 4, connecting with you to provide a brief update on government's actions to help strengthen and transform continuing care in our province. Next slide, please. Great. So this is just a quick overview of topics I'll touch on in this presentation. Don't mind me as I might have to speak awfully fast. Next slide. So thanks to Michelle and Latifa and Sophie. I don't have to go over this one very much. It's just describing the continuing care system that they spoke so eloquently about. What I will draw your attention to, however, is some new language that we're starting to use, specifically in the yellow there, continuing care homes. So we're using this now as an overall term to indicate designated support living and long-term care, that is sites that receive public funding to provide facility-based continuing care. This term is now enshrined in our new Continuing Care Act, which I'll talk about in a few moments. Next slide, please. There we go. So government recognizes the need for more continuing care and that it will rise, and that the continuing care system must evolve to respond to the needs of an aging population. So government's 2019 platform contains several commitments in the continuing sector, including creating new personal care homes or small care homes for 15 or fewer people who need continuing care supports, improving palliative and improving palliative care, including awareness to it and access to it, increasing caregiver supports, especially for those living in home and community, and prioritizing capital funding for creating additional continuing care spaces. The facility-based continuing care review kicked off in 2020 and included public engagement with more than 90 interviews and 7,000 survey responses from a wide range of stakeholders, potentially including some of you. In May of 2021, the final report identified 42 recommendations, which focused on a significant shift to more care in the community and recommendations to address quality of life, quality of care, resident choice, navigation information, and workforce. So I'll touch upon these later in the presentation. Also, learnings from the COVID-19 pandemic were incorporated and addressed in these recommendations. Next slide. So between the platform commitments and the facility-based continuing care final report, a plan for transformation emerged. So 3 pillars to improve continuing care and maintain system sustainability were identified, as you'll see on the screen. These pillars include expanding home care, improving workforce capacity and supports, and prioritizing quality. The continuing care transformation work has been divided into 8 different work streams, which you can see in the middle section of those pillars, as well as on the bottom. So today I've been asked to focus on a few areas, including the legislative framework, home and community care, and enhancing continuing care capacity. I'll also briefly mention some of the other initiatives at the very end. Next slide. So since 2020, we've made significant progress on a number of initiatives in the continuing care sector while still maintaining ongoing focus on keeping people safe during the pandemic. Some of these achievements are highlighted on this page. So in step with our initiatives to expand palliative support, in May of 2021, we included coverage for the costs associated with pre-filled syringes under the palliative coverage program. We just got a wonderful tour of the Continuing Care Facility Directory. And as of July of 2021, public reporting was expanded on that directory to include audit results from the Continuing Care Health Service audits. So those are now publicly available. We're also in the process of updating our continuing care design standards and best practice, which we anticipate to be released later in 2022. There's the first capital grant call for the Indigenous Capital Grant Program, which closed in December of 2021, and successful applicants are announced soon. We've also received ministerial approval to annualize the program, meaning there'll be more opportunities for Indigenous communities to access continuing care homes on and off reserve and settlement. There's the expansion of the Continuing Care Facility Directory. So that included those supportive living sites, as well as what we are now calling continuing care homes. And then there is also a palliative and end-of-life care grant call released for community-based applicants and organizations to support earlier access to care, education training, or community supports and services, and research and innovation. Results of that grant call are expected soon. And last but not least, the Continuing Care Act has been developed, but I'll talk about that more in subsequent slides. So supports to community partners. Government has also provided supports to other organizations to support services to enable people to remain at home. All these initiatives are targeted at enhancing the quality of life for Albertans in the continuing care system. And that's the #1 priority outlined in the facility-based review. So the Alzheimer's Society of Northwest Territories and Alberta received a grant to enhance community capacity in order to enable people living with dementia to remain active and engaged in their communities. That include things like the expansion of the Alzheimer's Society's First Link referral program to rural and remote communities, allowing families and caregivers to access services and learning resources to help navigate living with dementia. There's also the development of a community dementia ambassador program, volunteer ambassador program in rural and remote areas, and the development of resources for workplaces to support people living with dementia and their caregivers. Caregivers Alberta received funding to expand support programs and resources for caregivers. Lots of activities were included in the grant, including developing a public awareness campaign on caregiving, compiling an inventory of caregiver supports across the province, expanding the hours of the caregiver support phone line, establishing referral systems, updating and expanding support systems, providing employees with resources, and developing a coaching program for caregivers. Another example would be funding provided to United Way of Calgary and area for the purpose of developing and delivering community-based non-medical supports projects through seniors in housing. You would be very familiar likely with this support, but it's meant to support community-based senior serving sector to deliver non-medical services and support such as housekeeping, grocery and meal assistance, assisted transportation, system navigation, yard maintenance, snow removal, social connections, and other activities that promote healthy aging. Next slide, please. So now we're shifting into the legislative framework. Next slide. So there are challenges within our existing continuing care legislation. Right now, it's spread across 6 separate acts, 6 regulations, and 3 sets of standards, which were all developed at different points in time, some dating back to 1985. So some provisions in existing legislation are outdated, which adds layers of complexity and inconsistency across different aspects of continuing care, which creates barriers for responsive care and services. The existing legislation, based on when it was created and how it was created and what it covered, lacks cohesiveness and can create gaps and confusion in our regulatory environment for people accessing continuing care service, folks working within the sector, operators, providers, and others. So given these challenges, a new legislative framework is being introduced to regulate the full spectrum of continuing care settings. Bill 11, the Continuing Care Act, was introduced to the legislature on March 28th and received royal assent on May 31st. So this act is intended to be what's called framework legislation, giving the authority and oversight for future regulations and standards. It's intended to help address current issues in continuing care legislation and to help initiate transformational change within continuing care. So of the things it will do, it will increase clarity regarding services, address gaps and inconsistencies across settings, enable service delivery for Albertans, and support health system accountability. It's streamlined legislation that adds stronger protections, greater accountability, and oversight for the system. It reflects current practices, services, and settings, and will help to address the changing needs and expectations of Alberta. So if you go to the next slide, this is essentially how we intend to get from where we are now to implementation of the new legislative framework. So we are currently developing regulation content and drafting, as well as initiating standards work. This fall, we expect stakeholder engagement to inform regulation content and implementation. The full legislative framework, including the Act, regulations, and standards, will come into effect at the same time. So that will happen as early as spring of 2023. At that time, our existing legislation will be repealed. I'll note, however, that there's some implementation pieces that may take longer to come in effect, given the scope of the changes and sector readiness to implement. So it's going to take years for all the transformation initiatives to be implemented, which will support the successful implementation of the full legislative framework. But it all starts right now with the Act. Next slide, perfect. And again, so home and community care. So right now, the continuing care system supports approximately 60% of all continuing care clients through home and community care, and approximately 40% of continuing care clients in continuing care homes. That's designated support living or long-term care. Based on Albertans' preferences and to support the quality of life and system sustainability, our target is to move and shift that mix towards more care at home and in the community. And I'll describe how in subsequent slides. But essentially what we're looking at is going from 60% receiving care in home and community care to 70% by 2023. That would mean approximately 10,000 more Albertans will receive care and supports they need at home than if we continued with our current system as we have now. You will note though, that there is still an increase in both facility-based continuing care as well as home and community care. Next slide. So opportunities for improvement in home care. So in order to improve client outcomes, there's opportunity to improve them to enhance quality and delivery of home care services to clients and caregivers. There's an opportunity to address workforce constraints in urban rural zones, scheduling and coordination of services, to improve access to services for historically underserved populations or services that are not currently standardized across zones, as well as to address current gaps in service delivery, such as rural and regional home care access. Next slide. So Alberta has been working collaboratively with Alberta Health Services, Alberta Seniors and Housing, Alberta Community Social Services, and other community care partners and stakeholders to identify strategic directions and priorities for enhancing home and community care. So Alberta's home care path forward involves establishing legislative, policy, and funding structures to optimize home care as the first option for Albertans who need continuing care service, clarifying services and responsibilities through clear legislation and policy on what the home care program provides and updating service guidelines, empowering clients, families, caregivers by expanding access to the client-directed care option, strengthening focus on restorative and complex care, and enhancing supports for family and friend caregivers who do so much to help support Albertans to stay at home longer. Ensuring quality of home care services through innovative service models, optimizing virtual care and workforce recruitment, and strengthening accountability to focus on the outcomes that matter most. We also need to improve integration, coordination, community services, enhancing coordination between home care and other sectors such as primary care and social supports, and ensure information continuity and supporting Albertans in navigating access to the services that they need. So on the capital and capacity side, we're, like I said, also still building facility-based continuing care capacity. So as we saw in the proposed shift to home and community care slide earlier, even with increased home and community care, we need additional publicly funded continuing care home spaces for our growing population. Indigenous communities have limited access to sites that provide culturally appropriate continuing care on and off reserve and settlements. Albertans who require continuing care have complex needs such as addictions, mental health, physical disabilities, etc. And they often currently have limited continuing care options and experience long waits in hospital for appropriate care. The demand is increasing for other community-based options like those addiction and mental health supports and palliative end-of-life care. However, there's not a consistent and integrated approach to determining demand or planning of capacity for these care options. Finally, existing infrastructure is aging. More than half of our current long-term care facilities are 30 years of age or older. Next slide. I'll just note on this next slide here on identifying need, Alberta Health Services does have a really comprehensive model for determining where spaces are most needed that takes into account a whole range of factors, including but not limited to existing spaces, population demand, disease prevalence, including chronic disease, and demand for spaces that's derived from wait lists. We also have developed a community needs assessment for Indigenous communities who've been involved in collaboration on developing this model for Indigenous communities. Next slide. So as part of this transformation agenda, we're looking at how to create the best physical environments for people to live in. There's strong evidence now of the positive impact of smaller homes versus living in larger 100 or 200 bed traditional long-term care or nursing homes. And government also has that platform commitment to support the creation of innovative community options for seniors. So there's focus right now on eliminating shared rooms and replace or refurbishing older buildings, which will take some time as there's almost 12,000 existing continuing care spaces that need replacement or refurbishment. Government's also committed to providing Albertans with access to more continuing care spaces through the new continuing care capital approach. This new approach will develop additional continuing care spaces through initiatives that quickly and cost effectively add new continuing care spaces. These initiatives will prioritize adding spaces in areas with the identified greatest need and for populations who are underserved, including Indigenous communities, be driven by partnerships with private, nonprofit, and community operators, and incorporate and build upon some of the best practices of our Affordable Supported Living Initiative. Budget 2022 includes $204 million in capital funding over 3 years for continuing care. So this capital approach is reflective of and supportive of recommendations from the facility-based continuing care review. As I mentioned earlier, grant funding has been made available to Indigenous communities and organizations to build culturally appropriate continuing care spaces, both on and off reserve and settlement. We're expecting the announcement of those successful participants soon. And I'll go over these next 2 slides very quickly because they weren't necessarily the focus, but I'd like to make sure that I touch on a couple other priority transformation initiatives. So there are additional recommendations from the facility-based continuing care report that we're working on in the staffing realm, which is the second pillar to transforming the system. So we know that the demand for staff is high while supply is limited due to multiple factors, including the high cost of entry, such as education and training, limited full-time opportunities, recruitment or retention issues, because staff in continuing care homes are typically paid more than staff working in contracted home care agencies. And that continuing care is not seen as a desirable workplace by younger working age populations. So we're seeking to address these issues through multiple strategies that focus on expanding the workforce, retention of staff and supports, improved pandemic management, educational subsidies, more competitive salaries, and providing consistent staffing assignments, enabling staff to build stronger relationships with residents and clients. Next slide. Last but not least, definitely not least, third pillar is enhanced quality of life for residents. So this is at the forefront of transformation. This is to ensure that residents of continuing care homes will receive the care they need to meet their increasingly complex needs. We heard through the review that there's a definite need for quality of life standards and measurements, as well as more care hours to effectively support residents. So this pillar is going to be the most challenging to move forward, as is literally a culture change in the way that we do continuing care. It will require leadership and buy-in from staff, operators, residents who will need to champion a different approach. We have some models in place that are awesome within Alberta, and we need to find ways to spread those innovations and to sustain them in the face of ongoing system challenges that will always be there. Critical to being successful will be the public voice of families and residents. This cannot be a government top-down driven agenda, as it is based on interpersonal relationships with staff interacting with clients, residents, and their caregivers. Thank you. If you would like to send any information or have any questions as follow-up that we can't get to today, this email address is available for you, and please write in.
Excellent. Thank you so much, Kirsten, and thank you to all of the presenters for everything that they've done. So now it's time for our participants to ask their questions. So you can either do that by typing your question into the chat, and I have a couple I'm about to read out that people have already submitted, or you can get reactions and then raise your hand. We'll call on you, and then you can unmute and ask your question. So, okay, we have a couple that have been submitted already. One is, so of all the home care clients, how many are over 65? And how many are being served in their own home versus a facility?
You know, that's an excellent question. I unfortunately don't have the numbers right in front of me at this moment. Although I can try to see if I can pull them up while we're chatting. Certainly I can say majority would be over 65, although folks across the lifespan certainly are served by home care. I would say certainly a majority receiving support within their own home versus in, say, a senior's lodge or potentially a private supportive living. So yes, that's my answer at the moment, and I'll see if I can't pull up some numbers here while we move to other questions.
Okay, excellent, thank you. And then the other question I have is, so realistically, how long can a person continue to receive supportive living via AHS? Is there a general guideline, for example, care needs, especially though for those who are being cared for by a family member, so aging in place?
Yeah, just wanting to make sure I'm understanding the question. So certainly somebody who's been assessed as needing supports can receive those supports as long as they continue to have a need. And so that, that can be indefinitely, whether it's home care or in a designated supportive living or long-term care. I hope that's answering the question.
Okay, thank you, Sophie.
Sorry, I'm just hoping if I can elaborate more on that. So for folks living in supportive living, they can stay there for as long as their care needs can still be met at the designated supportive living they are assigned to. And in terms of the care needs and the guideline, so there are different levels of supportive living. We have SL3, SL4, and DSL4D, which is majorly our secured unit for dementia residents. So as long as they're still needing that 2-person assist and they don't require a registered nurse intervention, they can stay in supportive living for as long as possible. But when their care needs increases and they kind of need registered nursing intervention, that's when we start looking at placement into long-term care.
That's great. Thank you, Latifa.
And have you seen the clarification? So Judy says, I guess what I'm asking is whether the eligibility criteria will change over time. Who will ultimately decide? I don't know if there's anything else you wanted to add given that clarification.
So it doesn't, as long as they still need that 2-person assist, it doesn't change. I've come across situations whereby people move from supportive living back to their home, but it's on their own terms and not that we force them out of the supportive living. So as long as they still have that care needs that require 2-person assist, they can be monitored by a licensed practitioner nursing on site, they can remain in supportive living for as long as possible. And I hope that clarifies the question.
Okay, thank you. And then our next question is, what can somebody expect when they call 811 looking for housing assistance? I don't know who would like to take that one. Sophie?
Yeah, so certainly 811 does provide information and service navigation. Most likely what would happen is that they would connect you to your local continuing care access. So the information as well that we were showing on the slide and that Michelle and Latifa demoed for us, they would connect you most likely to be able to, if appropriate, to be able to to be assessed for continuing care services, and then can also potentially offer as well some advice and support related to non-healthcare related services as well. So it would be tailored to your unique situation, your unique specific question. We also shared about the dementia advice service that's available through HealthLink. So if there are questions related to dementia, they would support you with that as well.
Thank you. And then we have a question for Kirsten. If a community stakeholder wants information about how Government of Alberta decides which communities get continuing care space and what kind, where can they go and who can they contact?
Yeah, a great option for that would be to contact continuingcare@gov.ab.ca. Sometimes when there are opportunities or calls for grant applications for those priority need communities or requests for expression of interest or qualifications, they're most often posted on our Alberta Health website at alberta.ca or on Alberta Purchasing Connection. But if an individual is looking right now, they can contact continuingcare@gov.ab.ca to find out more.
Okay, great, thank you. And then the next question is, if I'm concerned that a neighbour or friend is not managing well in their home, who should I call? And I know there are some local resources, but are sort of more generally, what would be your recommendation?
Yeah, so anybody can call your local continuing care access center or 811. Now, certainly though, we're aware that there are other great non-health supports as well, depending on your local community. I know, for example, in Calgary, as you would know better, Sean, there's the weigh-in and the age-friendly resources as well. But certainly on the healthcare side, anybody is able to make that connection on behalf of someone else.
Yes, thanks, Sophie. In Calgary, there is actually an essential list of numbers for seniors that we refer people to that can help people kind of assess their own direct point of contact that they want to make. But I think that is actually all the questions that we've had so far. So thank you ever so much to all of our presenters and for all your experience and expertise. And I just want to kind of remind everyone that there are opportunities to see the recordings, both of this webinar and also the previous ones, if you go to the Core Alberta page, and you can see all of the different topics that we covered, we kind of described at the beginning. And I think that's a wrap. So thank you ever so much, everybody, for your time and participation.